In case you forgot, yes, we are all still in the middle of a pandemic. And in fact, the numbers are getting much worse. I'll get to that in a minute. But first up, this bit of news. 1 in 5 COVID-19 patients develop mental illness within 90 days. Now, I'm going to get a little more into why this may be the case. It may not be as bad as it sounds, but let me start here with a bit of information. Anxiety, depression, and insomnia were most common among recovered COVID-19 patients in the study who developed mental health problems. The researchers from Britain's Oxford University also found significantly higher risks of dementia, a brain impairment condition. Now, we'll get a little more into why this may be the case, but I imagine, a good percentage of people that have COVID-19, they become depressed, they become worried, they're anxious about the future, they're anxious if this is going to stay with them for a while, if there are going to be any other impacts, as we've seen studies showing that there are actually real long-term impacts to having COVID-19. Not for everybody, but for a good percentage of people that have COVID-19, they continue to suffer from issues like actually insomnia being one of them. But this is the kind of thing that could go away with proper treatment and or just with time. But dementia, this is a weird one because dementia is caused by damage to brain cells, which would make me think that COVID-19 can potentially do damage to brain cells. Now, again, the problem with all this research is that it's still early. COVID-19 has only been with us for under a year. So a lot of this really won't be figured out until there's some real long-term research on the impacts of COVID-19. So a lot of it right now is sort of speculation. But they go on to say here, researchers looked at the medical records of 69 million people in the U.S. between January 20th and August 1st. The data included 62,000 people who contracted COVID-19 as part of what the authors described as the largest study so far on links between coronavirus and mental health challenges. In the 3 months following testing positive for COVID-19, almost 1 in 5 survivors, 18%, were found to get a psychiatric diagnosis. This is about twice as likely as for other groups of patients with different illnesses and conditions analyzed as part of the study over the same period. Now, can this be explained? Well, they say here it could be explained by several factors, including a direct neurological or biological effect of the virus. Again, this is all speculation. The drugs used to treat it, the worry and anxiety caused by contracting the disease, and wider concerns about the pandemic, said study author Paul Harrison, a professor of psychiatry at the University of Oxford and Waynford Hospital. It's also possible that the data in the electronic medical records collected didn't adequately capture socioeconomic or behavioral factors that might explain the link. Quote, "We need to be cautious in our interpretation and unpick this important question," Harrison said in a news briefing. So again, we are still in the speculation stage, don't really know why there's a connection here, but that said, they have found a connection between some forms of mental illness and COVID-19. Now, let's go through some of the numbers, especially as it concerns the U.S., as they are clearly the worst out of anybody. So on November 4th, this was tweeted out by Eric Topol, who is a physician scientist. He tweeted out over 100,000 new COVID cases today, first time here or anywhere in the world, more than 1,200 deaths, hospitalizations relentlessly climbing to a new pandemic peak. Might be a good time for a new strategy, like having a plan. This was the 4th. On the 4th, over 100,000 new COVID cases in a single day. Well, just a couple days later, on the 6th, the U.S. went more than 2 months before amassing its first 200,000 COVID-19 cases. Its latest 200,000 have come in just the past 2 days. We're not done, as it's getting a lot worse. New York Post here. U.S. could soon hit 200,000 COVID-19 daily new cases, expert says. The U.S. right now on track to have 200,000 cases a day, when before this, it took them months to get there. So how does that look? Well, right now, total cases in the U.S., over 10 million. Total deaths, almost at 240,000. And by the way, these are the ones that we know about. My assumption is the number is actually much higher because of the way that a lot of these deaths are counted. You know, oftentimes if you had a pre-existing condition, they may blame that for your death as opposed to blaming COVID-19. But regardless, not a good number here. And let me show you how the U.S. looks compared to other countries. So this is daily new confirmed COVID-19 cases per million people. This is the rolling 7-day average. You see here how unique the U.S. curve is compared to other countries. So Americans never got out of the first wave. It was one wave into a second wave into a third wave that is just growing and growing and growing. Germany, meanwhile, first wave into a second wave that appears to be making a bit of a turn. The UK, same thing. First wave, a bigger second wave, and now it's leveling off a bit. Canada, we're still right now in the midst of the second wave. Mexico, I can't really explain this one. Just like it's kind of a first wave and then maybe up into a second wave. I don't know. And then countries that have their shit together: Japan, Cuba, Australia, China, and there are many others on here. South Korea is another one I could have put on here. Many countries that took masks seriously from the start, and that really was a lot of it. And just, I mean, also you have to, some places are islands, so it's a little easier to avoid, you know, civilization when you're like Japan or Cuba. But still, it's, this is uniquely American because of the Trump administration not taking this seriously from the start. And all they really had to do, all Trump had to do, not all he had to do, but one of the steps that he could have taken was send masks to every household, which was a plan that they had ready. USPS had that plan ready. Trump ended it in April. They had that plan ready in April. Trump stopped it and never took masks seriously. And this is where they are now.